Welcome to Lux Scout Psychology. Sleep. It's something we all do. We spend about a third of our lives asleep. Sleep is essential for our physical and mental health. It allows our bodies to repair and rejuvenate. During sleep, our brains process information and consolidate memories. When we don't get enough sleep, we can experience fatigue, irritability, and difficulty concentrating. Lack of sleep can also increase our risk of serious health problems like heart disease and diabetes. In short, sleep is not a luxury, it's a necessity. For some people, getting a good night's sleep is a constant struggle. They may have trouble falling asleep or wake up frequently during the night. These are signs of sleep-wake disorders. Sleep-wake disorders affect the quality, timing, and amount of sleep. They can impact mood, energy levels, and daily functioning. These disorders can increase the risk of accidents and chronic diseases. It's important to remember that sleep-wake disorders are treatable. Sleep-wake disorders are incredibly common. Millions of people around the world suffer from these conditions. Despite their prevalence, sleep-wake disorders are often misunderstood and underdiagnosed. Many people don't seek help from a healthcare professional. The impact of sleep-wake disorders can be far-reaching, affecting physical health, emotional well-being, and relationships. It's essential to raise awareness about sleep-wake disorders and the importance of seeking help. Early diagnosis and treatment can make a world of difference. Insomnia disorder is perhaps the most well-known of the sleep-wake disorders. It's a condition that makes it difficult to fall asleep, stay asleep, or both. Insomnia is not just about having a bad night's sleep every now and then. Insomnia disorder is a chronic condition that persists for at least 3 months and occurs at least 3 nights per week. The causes of insomnia are varied and complex. In some cases, insomnia may be a primary disorder, but it can also be a symptom of an underlying health problem. Understanding the causes is essential for effective treatment. Insomnia often becomes a vicious cycle. Difficulty sleeping can lead to anxiety about not being able to sleep the next night. This anxiety can make it even harder to fall asleep, perpetuating the cycle. Over time, people with insomnia may develop negative thoughts and beliefs about sleep. They may also engage in behaviors that interfere with sleep, such as napping during the day or consuming caffeine close to bedtime. Understanding these factors is essential for effective treatment. The impact of insomnia on daily life can be profound. Chronic sleep deprivation takes a toll on both physical and mental health. People with insomnia often experience daytime fatigue, making it difficult to concentrate and perform well at work or school. Long-term insomnia can increase the risk of serious health problems, such as heart disease and diabetes. Insomnia can also impact relationships and overall quality of life. The constant struggle to get a good night's sleep can leave individuals feeling exhausted and frustrated. While insomnia keeps people awake at night, hypersomnolence disorder has the opposite effect. It's characterized by excessive daytime sleepiness, even after a seemingly adequate night's sleep. People with hypersomnolence disorder may sleep for long periods yet still wake up feeling unrefreshed. This overwhelming sleepiness can make it challenging to fulfill daily responsibilities. The causes of hypersomnolence disorder are not yet fully understood. Some researchers believe it may be related to dysregulation of the brain's sleep-wake cycle. The unpredictable world of narcolepsy. Narcolepsy is characterized by excessive daytime sleepiness and sudden, uncontrollable sleep attacks. These sleep attacks can occur during any activity, making everyday life unpredictable and even dangerous. Narcolepsy can also cause cataplexy, a sudden loss of muscle control triggered by strong emotions. During a cataplectic attack, a person may experience anything from a brief sense of weakness to complete physical collapse. Narcolepsy requires careful management to ensure safety and improve quality of life. Living with narcolepsy can be incredibly challenging. The unpredictable nature of sleep attacks and cataplexy can make it difficult to maintain a normal routine. Driving is often out of the question, and many people with narcolepsy struggle to hold down jobs or maintain relationships. The emotional toll of narcolepsy can be significant, leading to feelings of isolation and frustration. However, with the right support and treatment, people with narcolepsy can live full and meaningful lives. Treatment typically involves a combination of medication and lifestyle modifications. Obstructive sleep apnea, or OSA, is a prevalent sleep disorder characterized by repetitive episodes where breathing stops during sleep due to the blockage of the upper airway. These episodes cause significant drops in oxygen levels in the body and can happen numerous times throughout the night. Each episode is typically followed by a brief awakening that restores normal breathing but disrupts sleep quality. Symptoms of OSA can include loud snoring, episodes of stopped breathing during sleep, and morning headache. These symptoms significantly disrupt sleep, leading to excessive daytime sleepiness and fatigue. Identifying OSA often involves an overnight sleep study called polysomnography. Early diagnosis and treatment are vital to prevent complications such as cardiovascular disease and mental health issues. Obstructive sleep apnea doesn't just disrupt nightly rest, it has far-reaching implications on overall health. People with untreated OSA experience intermittent oxygen deprivation that stresses the cardiovascular system, leading to higher risks of high blood pressure, heart disease, and stroke. This sleep disorder also affects metabolic health with a strong link between OSA and type 2 diabetes. The fatigue and disrupted sleep patterns contribute to poor dietary choices and reduced physical activity, exacerbating the risk of obesity. Chronic sleep interruption can lead to mood swings, anxiety, and depression. Cognitive functions such as memory and concentration are also impaired. Management strategies for OSA often include lifestyle modifications, use of continuous positive airway pressure (CPAP) devices, and in some cases, surgery. These treatments aim to keep the airway open during sleep, reduce snoring, and improve overall sleep quality. Comprehensive management is essential to mitigate the health risks associated with OSA. Central sleep apnea, or CSA, is less common than OSA and involves a different mechanism. Unlike OSA, which results from a physical blockage of the airway, CSA occurs when the brain fails to send appropriate signals to the muscles that control breathing. This results in periodic cessation or decrease of breathing effort during sleep. The causes of CSA can vary from being idiopathic to being associated with illnesses affecting the brainstem. Conditions such as heart failure, stroke, and neuromuscular disorders can also predispose individuals to CSA. Symptoms of CSA can overlap with those of OSA, including disrupted sleep and daytime fatigue. Treatment may involve addressing the underlying conditions, using devices to assist breathing, or medications that stimulate breathing. Understanding and distinguishing between different types of sleep apnea are crucial for effective treatment. Each requires a tailored treatment approach to ensure the best possible outcomes. We all have an internal clock that regulates our sleep-wake cycle. This internal clock, known as the circadian rhythm, is synchronized with the 24-hour day-night cycle. When this balance is disrupted, it can lead to circadian rhythm sleep-wake disorders. These disorders can manifest as difficulty falling asleep and waking up at desired times. Several factors can contribute to circadian rhythm disorders, including genetic predisposition, irregular sleep schedules, shift work, and jet lag. The impact of these disorders extends beyond just feeling tired. They can affect mood, concentration, work performance, and overall quality of life. Recognizing the symptoms and seeking professional help is crucial for diagnosis and management. Circadian rhythm sleep-wake disorders encompass a spectrum of conditions. Delayed sleep phase disorder, or DSPD, is a common type where individuals have a natural tendency to fall asleep and wake up later. Advanced sleep phase disorder, or ASPD, is characterized by an earlier than usual sleep-wake cycle. Shift work disorder specifically affects individuals working night shifts or rotating shifts. Jet lag disorder arises from rapid travel across multiple time zones. Understanding the specific type of circadian rhythm disorder is essential for tailoring treatment strategies. Some individuals might benefit from light therapy and chronotherapy, while others might require behavioral interventions and medication. Effective treatment can regulate the sleep-wake cycle and improve quality of life. Parasomnias are a group of sleep disorders characterized by unusual or undesirable behaviors during sleep. These can range from sleepwalking and night terrors to more complex behaviors like sleep-related eating disorder or REM sleep behavior disorder. Imagine waking up to find you've eaten an entire cake in your sleep or acted out a dream. Factors like genetics, sleep deprivation, stress, medications, and underlying medical conditions can play a role. NREM sleep arousal disorders, like sleepwalking and sleep terrors, typically occur during the deeper stages of sleep. Sleepwalking involves getting out of bed and moving around while asleep. Sleep terrors are characterized by sudden awakenings from sleep accompanied by intense fear and autonomic arousal. Understanding restless leg syndrome. Imagine lying in bed ready for sleep, but an irresistible urge to move your legs takes over. This sensation, often described as creeping, crawling, or aching, is the hallmark of restless leg syndrome, or RLS. Symptoms worsen at night, making it hard to sleep. Movement like stretching or walking provides relief, but it's temporary. The exact cause is unknown, but it may be linked to a dopamine imbalance. The impact of restless leg syndrome on sleep can be significant. The constant urge to move the legs can make it difficult to fall asleep, leading to insomnia and daytime sleepiness. People with restless leg syndrome often wake up feeling unrefreshed, even after a full night's sleep. This can lead to fatigue, irritability, and difficulty concentrating during the day. The symptoms of restless leg syndrome can also make it challenging to sit still for extended periods, such as during work, school, or long car rides. This can make it difficult to focus on tasks, participate in social activities, or even enjoy a relaxing evening at home. Restless leg syndrome can also have a significant impact on relationships. Bed partners may be disturbed by the constant movement and restlessness, leading to sleep disruptions and frustration for both individuals. Managing restless legs syndrome, treatment and lifestyle changes. There are effective treatments to manage RLS symptoms and improve quality of life. Treatment involves lifestyle changes, medications, and alternative therapies. Establishing a regular sleep schedule, avoiding caffeine and alcohol. Moderate exercise can help, but avoid exercising too close to bedtime. Taking a warm bath or using a heating pad. Medications are often prescribed to manage RLS symptoms. We've journeyed through the diverse landscape of sleep-wake disorders, uncovering the complexities of each condition and its impact on daily life. From the frustrating wakefulness of insomnia to the disorienting world of narcolepsy, from the disrupted breathing of sleep apnea to the restless nights caused by RLS, these disorders highlight the crucial role sleep plays in our well-being. It's important to remember that you're not alone in this journey. Millions of people worldwide experience sleep-wake disorders, and the good news is that effective treatments are available. The first step towards better sleep is acknowledging the problem and seeking professional help. Don't suffer in silence. Talk to your doctor about your sleep concerns. They can assess your symptoms, make an accurate diagnosis, and recommend the most appropriate treatment plan for your individual needs. Early diagnosis and intervention are key to improving sleep quality, reducing daytime impairment, and preventing long-term health consequences. The good news is that there is a wide range of treatment options available for sleep-wake disorders. The specific approach will depend on the type and severity of the disorder, as well as individual preferences and medical history. For some, lifestyle modifications may be sufficient to improve sleep. These modifications include establishing a regular sleep schedule, creating a relaxing bedtime routine, avoiding caffeine and alcohol before bed, and getting regular exercise. Cognitive behavioral therapy for insomnia, or CBTI, is another effective treatment option, particularly for chronic insomnia. CBTI helps individuals identify and change negative thoughts and behaviors that contribute to sleep difficulties. Medications may also be prescribed for some sleep-wake disorders. For example, sleep aids can provide short-term relief from insomnia, while stimulants can help manage excessive daytime sleepiness in conditions like narcolepsy. Taking control of your sleep. While professional help is essential, there are steps you can take to improve your sleep hygiene. Create a conducive sleep environment. Make sure your bedroom is dark, quiet, and cool. Invest in a comfortable mattress and bedding. Establish a regular sleep-wake cycle. Go to bed and wake up at the same time daily. Avoid caffeine and alcohol before bed. Exercise regularly but not too close to bedtime. Engage in calming activities before sleep. Reclaim the restorative power of sleep for a healthier life. Please like the video and share it with others. It helps those who are suffering. Thank you for watching.